Now, for those folks who do tolerate a CPAP and they sleep regularly with a CPAP and simply just want to sleep more comfortably using their CPAP, it's completely achievable, and it's through the use of combination therapy. Combination therapy involves the use of an oral appliance and a CPAP at the same time. How does this work? Well, the oral appliance repositions the jaw and stabilizes the lower jaw in such a way that it prohibits the collapse or the blockage of your airway when your muscles relax during sleep. At the same time, being that now your airway is maintained opened, your CPAP can be adjusted so that the effective dose pressure necessary for the apnea to be resolved is much less. In other words, putting it simply, you can reduce the pressure on your CPAP so that perhaps if you're thinking about maybe giving up on CPAP because your airway, your upper airway is too dry, maybe your nose is too dry or your mouth is too dry, you're waking up with very, very dry nose and mouth, and then we can handle that easily with combination therapy. There's also type 2 combination therapy where the oral device and the CPAP are attached to each other. This is a wonderful solution for people who want to sleep without the straps, who may be wanting to give up on their CPAP because they can't tolerate the straps, or they just can't sleep with the straps, but they absolutely need their CPAP. This is a wonderful solution. How does this work? Well, again, like type 1 combination therapy, where the CPAP and the oral appliance are not attached, the same thing, the same benefits apply with type 2 combination therapy. In other words, we can reduce more than likely the pressure of the CPAP. The airway is stabilized. If it's a custom mask, there's no leakage. And quite frankly, just sleeping without the straps around your head and face makes it that much more comfortable for sleeping. We're proud to be one of the few practices in the country that makes the Fusion custom mask available for patients that suffer from either too much pressure or they just can't find the right pressure to relieve their obstructive sleep apnea. If you want to know if you're a good candidate for combination therapy, click the link below. If you are considering giving up on your CPAP, don't do it before seeing us, because we may be able to make that sleeping with a CPAP much more comfortable. Don't give up on your obstructive sleep apnea. That's what we're here for. Controlling your sleep apnea really does change your life, and it betters your health and lifestyle and marriage for the better. We look forward to seeing you. Click the link below now, and once again, make it a great day, and thanks for tuning in.